The following program is a production of Pioneer Public Television. Major support for Compass is provided by the ongoing support of the Leo P. Flynn Estate of Millbank, South Dakota. Additional support is provided by the Southwest Minnesota Private Industry Council, promoting Southwest Minnesota as a place rich with opportunity. Come for the jobs, stay for the lifestyle. More information at swmnpic.org.
Hello and welcome to Compass, a production of Pioneer Public Television. I'm Les Heen, your host for Compass. This is a weekly discussion of public policy and important issues facing our viewing area. This week, we will talk about how rural societies are aging and what concerns communities are faced with when dealing with aging. We'll have representatives from the Minnesota River Area Agency on Aging, as well as the Chippewa County Montevideo Hospital. We'll touch on what services and programs are available at a community or individual level to improve the quality of life for older citizens. First, Pioneer's Laura K. Prosser takes us to a Matter of Balance workshop. It's one of the many evidence-based programs that the local Living at Home Block and Nurse Program group has started to offer to citizens. Here's Laura's report.
For rural retirees, it's not always easy to get out and be active. However, in Granite Falls, thanks to the Living at Home Block Nurse Program, a nonprofit network that exists in 33 communities across the state, gap services are finally being filled in, where others have fallen short. It's simply a matter of fact, or if you ask Mary Imes, program director, it's a matter of balance, and programs like the Matter of Balance to get seniors living right. Mary, welcome.
Thank you.
So Mary, tell me a little bit about the Living at Home Block Nurse Program.
The program has been in existence for 15 years.
Okay.
And it started with the need of elderly people and the disabled that needed assistance in transportation, in-home help, and it expanded to friendly visits and respite care, which is a big need here. And as it grew, there became more people interested in the program, professional people, like the hospital and the clinic. We provide rides to the clinic and the hospital for physical therapy and just doctor visits and whatever. And then we added the evidence-based programs, the chronic illness, which more than 84% of people age 65 are coping with at least one chronic condition.
Oh, wow.
So we offer that evidence-based program. Then we offer the Matter of Balance program.
Well, and with the gap services you provide and the programs like Matter of Balance, why is it so important to offer these type of things in rural areas?
Well, we want to keep the people as healthy as possible to enjoy their life.
Where else are they going to go?
And there is nowhere else that these are offered, other than a distance where that's impossible for most of them.
So walk me through the Matter of Balance class. Tell me a little bit about that.
The evidence-based program, which it is, basically highlights the fall prevention. It is very detrimental to people because even at my age, we lose our balance. And it's so important to stay active, and these exercises, which are not strenuous, have proven very valuable.
And what do they do in a class like this?
Well, we do the exercises, and we also have a manual that we go by to give them tips on how to be aware of their surroundings.
So how is the evidence-based class, the Matter of Balance, a class that is kind of epitome for the Living at Home Black Nurse Program?
Well, I would say that all three evidence-based programs that we offer are very important to our program. The other one I didn't mention was Powerful Tools for Caregivers, and that's another whole subject where the caregivers are really needing help because of the care they give their partners. So we offer a support group every month for those people. And Powerful Tools for Caregivers is another evidence-based class. We offer them and other caregivers to help cope with their caregiving experiences.
So it's Matter of Balance, the Caregivers class, and what was the third one?
Chronic illness self-management.
There we go.
And there again, we have our flyers down at the clinic.
So we just got done talking to Mary Imes of the Home Black Nurse Program about the Matter of Balance program they have going on. Now, Matter of Balance is also a program that Mike Brown works on as a physical therapy assistant, correct, Mike?
Correct.
Tell me a little bit about your involvement in this program.
I got called in from the block nursing program to just talk about falls and fall prevention. So that's where I got called in from a physical therapy standpoint.
Now, why is that such a key aspect to talk about for senior citizens?
You know, it's a real epidemic right now. I think falls are the #2 reason to visit a doctor for the elderly. And so we needed to do something preventative. We didn't want to keep picking up the pieces, if you will, after someone fell. So we decided to tackle it from a preventative way, and the block nursing program approached me with the Matter of Balance, and it sounded like a really good program, so we decided to get involved from a local standpoint, and it's been a really good involvement.
So what are some key points about balance that you try to press?
We try to keep people focused on their environment around them, what kind of things could cause them to fall. We also tell them to keep in good health, good shape, do some exercises, stay as healthy as they can, and to be aware of what medications and stuff they're taking to make sure that that's not affecting their balance. We work in a small town hospital, so a lot of the people we've seen in the program have been former patients of mine. Those patients oftentimes come back because they've fallen at home. Since the program has started and we've had more involvement, more preventative type things going on, we're seeing less and less of those familiar faces coming back, which we really like.
So what kind of impact have you seen working with these people? What have you heard? Why do people keep coming back?
And I think it's the knowledge they're gaining so that they can prevent falls themselves. The elderly, if you've fallen one time, you become very fearful of falling a second time, and those people can become quite reclusive. By coming to these programs and getting even out of their house to come to the program, it's a big step forward sometimes. So if we get that initial contact with them, we can teach them some skills that they can carry on with, and that's made a big impact in the community itself.
And maybe that's why the Matter of Balance program is so important. They take a couple classes and they can bring it back into their homes for the rest of the time.
Yeah, absolutely. The information I give and the things that are brought up through the Matter of Balance are all things that can be taken home and put into use there. I think that's a real important part of the program.
That's it from Granite Falls. I'm Laura K. Prosser, producer of Compass. Back to Les in the studio.
With us now to talk about regional efforts to improve the lives of aging folks in rural areas. We have two folks with us today for that conversation. We have from the Minnesota River Area Agency on Aging, and she's from Mankato. We have Kim Madsen. Thanks, Kim.
Thank you.
And we also have Lori Peterson, who's with the Chippewa County Montevideo Hospital. Thanks both for coming in.
Thank you.
So we want to talk today about some challenges or some problems and also some solutions, but let's start with some of the challenges first. So what are some of the biggest challenges right now that either one of you is seeing with aging populations in Minnesota? And Kim, I'd like to start with you if we could. What are some of the challenges?
Yeah, so at the Minnesota River Area Agency on Aging, we cover the southwest 27 counties of the state. There are other area agencies on aging across the rest of the state. But in rural, what we're seeing is housing, affordable housing, senior housing. So we're looking at having the correct width of doorways, no stairs, the one level living that really is more convenient, and not having the massive houses. And you'll see that many times over and over if you would go and search out YouTube or other videos that are dealing with information on housing, is that we have built our communities really with 3-4 bedroom ramblers And as we're having the aging population, no longer do we need a 3 or 4 bedroom rambler, but people wanting to maintain and stay in their homes. So really housing, affordable health care, access to health care, limited services, and this falls in the transportation, is really as once I no longer decide or feel that I can drive any longer, and if I'm in a small community, and just for example of 400 people, is that there might not be a daily bus route. You know, in Willmar, we have that daily community transit that goes, but if you're in Morton, Minnesota, you don't have that.
Lori, in your work in Montevideo, there's the same kind of challenges that you've seen with it?
You know, in my work, I work as a memory care coordinator. And so we know that there are people living at home with dementia or memory loss, and even trying to get them connected to resources so that they can stay in their homes and make things work for a longer period of time is so very important. And so, you know, there's a lot of challenges, but we just need to help reach out and help connect people to those resources.
When you talk about resources and services, that leads to the question about, you know, services that people may need to have access to, but they don't necessarily even know the services are available. Are there some examples of things that you know, can really help folks as they go through those issues?
We have a memory care clinic in Montevideo, and so people can come and have their cognitive or their memories or their thinking skills evaluated. And then once that process is over, my position is to help people with memory loss make those connections. There are a lot of resources available, and when a person receives a diagnosis and if they're just sent out the door, oftentimes they have no idea where to start. And so I can help put those pieces of the puzzle together for them. We have things like in-home respite, where a person can come in and provide some respite for the caregiver. We have a respite program in Montevideo that a lot of people are not taking advantage of, where a person with dementia can come for 4 hours and the caregiver gets some relief. But there are a lot of programs through the Alzheimer's Association, and we just need to connect and educate people.
And I'm sure, Kim, that over the entire region you deal with, you probably see this sort of story repeated over and over again, right?
It is, and it's on multifaceted levels. So here we're talking about dementia, but you can really talk about as we age, we really become a society becoming fearful of aging. And that shouldn't be. And as we look, you know, I work in Graceville, Ortonville, across these existing counties right here, and my staff work the other areas. But we're, as program developers, really out trying to work with hospitals, clinics, agencies to institute and implement programs such as Matter of Balance, powerful tools for caregivers. Caregivers are an utmost importance when we're talking about rural Minnesota, and really helping any community figure out, do a community assessment, figure out what programs could be most helpful for the aging population within your community. Because if there aren't those programs, people are going to move. And if this has been my home and I raised my family here, I would love to stay in my home, but if I can't, then what are my other options for housing? What are the programs that will help me stay here in this community and with the people who are my friends?
We don't want to lose people.
Right.
You know, oftentimes if, like, we grew up in a very small community, and so there aren't all the housing options. So if a person cannot live in their home anymore, or maybe we should even back that up. Maybe they just need some services to come into the home to assist them to stay in their homes longer. And there are those resources available. But if it gets past that level and people need an assisted living or need that little next step, oftentimes some of our rural communities don't have that to offer. And if that's the case, and then they have to move to a larger community, we lose them, because once they leave our small community, they're no longer a part of that community.
And some of those challenges, I suppose, Lori, are as simple as a grocery store,
Right.
being able to walk to a grocery store if it's there inability perhaps to drive anymore a few blocks if they're unable. So I mean, some of these things, if you look at them, may be relatively simple for other people to help solve.
Exactly, and this is one of the things Lori and I were discussing just earlier, is how we really need communities to start to rally and support their neighbor. And so, because if I no longer can go to the community center for my meal because I don't drive, or if I need to stay in my home for safety reasons, how can we get organizations and individuals to start volunteering, say, my company is going to take January and we're going to deliver those 5 meals every day. We really need to figure out how as a society we can rally to support our growing population of elders, because if we don't, it's hard to sustain those programs. And that's when it comes down to, is we can create any program, but if there isn't a sustainability factor to it, they go away and we're right back to square one. So we're always looking for, how do we sustain a program if we're going to build it?
You said that at the hospital, for example, you have people who specialize in this, so they will help people to take the first steps and understand what the challenges are, what the cognitive impairments are, or in their own home, for example, what little things they may need to help them stay there. Are those all part of the first steps typically?
Yes, well, actually, the first step would be just getting that memory screen, you know, if we're talking dementia.
Sure.
And that can come at every year at their Medicare physical, if you will. That's part of that. And if people aren't offered that, they should really ask for it, because it is important to know how your memory is doing.
Right, it's to get the baseline. And even so, I'm in my 40s and I know where my cognitive baseline is. Because it doesn't, if your cognitive ability changes, it doesn't necessarily mean you're going towards dementia or Alzheimer's, but there are things that you can change in your life to create a better quality of life. So for everyone to understand where their baseline is cognitively is just like knowing your baseline for your blood pressure or your sugar. I mean, it's just any of those. It really should fall right in line. And we shouldn't be afraid, because sometimes if our cognitive changes, it might be due to a medication interaction. It doesn't always mean, but we're so fearful as a society and of the kind of the taboo around cognitive change as Alzheimer's or dementia. And Lori can speak more to it because she's the one who sees that every day. But I think it's empowering, and the more that we know and the more that we learn and empower ourselves, it just creates a better life.
I know we've got about a minute and a half left here, so I just want to touch on some of the solutions, places to go, because there's things like the senior linkage line, which we'll mention in a moment, so folks can get ready with a pencil for that one. But what are some of the other things that, as people start to deal with these aging issues, what are some of the resources or places they can go after this program is over to look up more things? So, Kim? So
the senior linkage line is the Minnesota Board of Aging Senior Linkage Line. It's an 800 number. It's 800-333-2433. And that is from 8 to 4:30. There's someone who can answer any question. I look at them as the navigator on any senior-related issue. If you have a Medicare question, we do have senior outreach specialists who do one-to-one consulting for that. Medicare, any question you might have on finding a resource. Also, MinnesotaHelp.info is also another great website, or the Minnesota River Area Agency on Aging website also. Okay.
Lori, tips that you would have for folks on where to go?
Well, if they're concerned, the Alzheimer's Association has a wonderful website, and that's actonalz, ALZ.com. I believe, and so they could go there. And of course, if it's more right in this area and they want to give a call to the Chippewa County Montevideo Hospital, we could learn more about our memory care clinic, and we could certainly share that information with them.
Okay, great. Kim Madsen, Lori Peterson, thank you for joining us in Compass for a discussion about aging. Thanks very much. And that's it for this week on the topic of aging in rural areas. Our Compass producer, Laura K. Prosser, will take it from here and end this week's episode with the next installment of the Compass Literature Corner. Thanks for watching.
As part of the new segment to the show called the Compass Literature Corner, we are talking to local authors who have had an impact on this region, or whom this region has had an impact on. However, today we are out of the studio and in Marshall, Minnesota, where we are talking to the keynote speaker of the Southwest Initiative Foundation's Grow Your Own Summit. This author has less of an impact on the region and more of an insight into an issue in our region. Ladies and gentlemen, I'm proud to say that today's guest is the political scientist Robert Putnam. Robert, welcome.
Thanks very much.
So tell us a little bit about what inspired your eye-opening book, Our Kids, The American Dream in Crisis.
It was inspired in part by learning more about the current situation in my hometown. I grew up in a little town, small town in Ohio. Kids from all social classes mingled and so on. And then my research team and I went back there a few years ago to kind of see what the situation was like now. And frankly, a disaster had hit. The town, this little town, was much more divided in economic terms. There was one set of homes along Lake Erie there. There are $1 million mansions, but then just on the other side of the road were the dilapidated double wides and the shacks, and the kids on those two sides of that one road, it's called East Harbor Road, I'm talking about a real road. The kids on that side, the sky's the limit. The kids on this side, they have no future.
No opportunity.
And no opportunity. And that was not true. We know, because I've gone back and talked to all my classmates of the high school class of 1959. It wasn't true then, it is true now. And what that reflects, and this is the more general point, is a growing gap between rich kids and poor kids in Port Clinton and across the country.
Now, when you define the opportunity gap, you define the impact it has on the economic future of America. So what are the most crucial social economic settings that are maybe most influential to this gap?
Well, the gap has grown for a number of big reasons. If you go up to the 30,000 foot level and say what's happened that's caused this, partly it's the growing income gap between rich families, or between affluent families and impoverished families, and therefore parents on the right side of the tracks are able to afford more things, and they are spending more money on their kids, and they're spending more time with their kids. A second big difference is actually probably more important but is less well known, which is that American society has become more segregated in social class terms. We're not more segregated in religious or racial terms. We're now all jumbled up in religious and racial terms. But in social class terms, increasingly, we're either living in rich enclaves or in poor enclaves.
There's not as much exposure to the poverty, so there's not as much empathy.
That's exactly right. You can see the same things happening in the schools. These kids are mostly going to schools where all the kids in their backpack, going to these affluent schools, in their backpack they bring their parents' aspirations and their parents' resources and their parents' trips to Paris. And these kids over here, when they go to school, in their backpacks they're bringing, gang violence and drug abuse at home. And you see the same thing in terms of the opportunity that kids have to connect with other caring adults. For example, there's a gap like this in terms of extracurricular activities.
Because of the pay to play.
Because of pay to play, exactly right. So, as I say, you go through all these different facets of people's lives, the close focus on the family, and then you come wider and you see the same thing is true. These kids, the affluent kids, are going to church still. These kids aren't because their parents aren't. That means they don't have caring adults outside their immediate family. It's a miracle that there are still some kids from over here who are able to make it up, but fewer and fewer of them will be, not because they're not smart, not because they've done anything wrong except choose the wrong parents, and that's not fair.
So, in the words of your book, what is to be done? What are some of the important solutions that you think we should focus more on in the future?
A different sphere might be we need to make some reforms in K-12 education. The problem wasn't caused by schools. The problem was caused outside of schools, but K-12 improvements can be helpful. But it also means things like mentoring. I mean, these kids on the right side of town have lots of other adults outside the family, pastors and coaches and neighbors and so on, and these kids don't. These kids are increasingly alone. And so you need to think about mentoring. You need to think about getting churches and other community institutions involved in not just drop by, not just, once a year having lunch with a poor kid and saying, how's your life going, kid? We wouldn't do that to our own kids. The way we raise our own kids is to be there when they need them, when they need us.
Offer a helping hand.
Exactly. And that's what we need to do for these kids over here, too.
So in Chapter 1, you state Americans believe that income inequality has increased in recent years, and they're right. But they aren't so sure about the equality of opportunity. But this is crucial for the book, is that conventional indicators of social mobility are 3 or 4 decades behind.
Yeah.
So explain what kind of challenges this perspective that the older generation has on any changes.
That's where the title of the book comes from. The title of the book comes from the fact that when I was growing up and my parents used the term our kids, they didn't mean my sister and me. They meant all the kids in town. That the term our kids meant all the kids in town. But over the course of the last 50 years, the meaning of the term our kids has shriveled. And so if you talk to people in Port Clinton now about the poor kids in town, they say, well, it's a sad story, but they're not my kids, they're somebody else's kids. Let them worry about them. That's partly what's changed. We no longer have this sense that we're all in this together, and that therefore I have an obligation and an interest, an economic interest as well as a moral obligation to worry about other people's kids. And, some people are going to say, sure, not my problem, let somebody else worry about it. But I think a lot of people are going to say, now that I see that story, yeah, I got to worry about it. And I will say one last thing about the stories. I speak to people all over the country. I've spoken to hundreds of audiences about this. And in my standard talk, I talk about a particular young woman from my hometown named Mary Sue. And she's led, through no fault of her own, a terrible life from beginning when she was very little. And after I talk, this happened just yesterday in the Quad Cities in Iowa. After my talk, a woman came up to me and said, I'm Mary Sue. And she began crying. And I'm not trying hard not to tear up. She said, you've told my story, but no one else knows that story. And so the power of these stories, I'm sorry, I'm getting a little soppy here at the end, but the power of these stories is people recognize themselves and others in these stories.
And they respond, and they're more likely to follow the movement towards
Exactly.
change. Robert, thank you so much for joining us on the Compass Literature Corner.
Thank you very much.
That's it for the Compass Literature Corner. Please tune in next week for more people, places, and issues facing our viewing area. I'm Pioneer's Laura K. Prosser, and may your compass always point you in the direction of a good book.
Major support for Compass is provided by the ongoing support of the Leo P. Flynn Estate of Millbank, South Dakota. Additional support is provided by the Southwest Minnesota Private Industry Council, promoting Southwest Minnesota as a place rich with opportunity. Come for the jobs, stay for the lifestyle. More information at swmnpic.org.